Good evening, one and all. On behalf of the Rotary Club of Hyderabad, jointly with the LV Prasad Eye Institute, we warmly welcome to the 25th Dr. Rustam Ranji Rotary Award Lecture 2024. This evening is very special both for the award celebration and also the Rotary Club of Hyderabad, because the Rotary Club of Hyderabad is now celebrating its 75th year of glorious service for the community. And the best part here is another landmark account happens here is that this is the 25th Rustam Ranji Award. So 25 and 75 matches it. So in that, it combines 100, 25 plus 15, 100 glorious years of service to the community. A special mention to be there for our own Rotarian, your Chairman Emeritus, Dr. G, and being there with us for the Rotary, making sure that this award is being continued for the 25 years. Thank you so much, sir, on behalf of the Rotary Club of Hyderabad. We know you are a part of our family, Rotary family, but again, the privilege goes there. The Rotary Club of Hyderabad, which is one such unit for the Rotary International, serving the community from over 110 years, was founded on the 29th September 1949 with 50 charter members. The charter was granted on the 31st December 1949, making it the oldest in the Twin Cities. This Rotary Club of Hyderabad, which is 75-year-old, has sponsored or supported 11 more new Rotary clubs in and around AP and Telangana. And they're all, the first Rotary Club which we have sponsored is 64-year-old. It is called Rotary Club of Hyderabad North. And the same way, the charter president was Nawab Jang Bahadur, and the charter secretary was Dr. R.K. Bandari. The club has the unique distinction of having a few presidents of India, state governors, chief ministers, heads of state as honorary members. In its 75 years of existence, the Rotary Club of Hyderabad has taken many service projects under the 7 areas of focus: disease prevention and treatment, water sanitation, maternal and child health, basic education and literacy, economic and community development, peace and conflict resolution, and the 7th area of focus, the environment. With no more ado, we will go ahead with our Dr. Rustam Ranji Rotary lecture. To make the formalities of Rotary, I request our 75th year president, Rotarian Rizwan Haider, to call the meeting to order.
The meeting is called to order. Good evening, esteemed guests, fellow Rotarians, and friends. It is my great pleasure to welcome you all to the Rustam Ranji Rotary Award function here at the prestigious LV Prasad Eye Institute tonight. We gather not only to celebrate outstanding contributions to our community, but also to honor the spirit of service and dedication exemplified by Rustam Ranji. As we reflect on the values of Rotary service, integrity, and fellowship, we recognize the transformative impact that the committed individuals can have on the lives of many. This award serves as a reminder of our responsibility to uplift those around us and to strive for excellence in all our endeavors. I would like to extend my heartfelt gratitude to the LV Prasad Eye Institute for hosting us this evening and for their unwavering commitment to eye health and community service. Your work inspires us all. As we proceed with the program, let us celebrate the achievements of our awardees, who embody the essence of Rotary and contribute significantly to the welfare of our society. Together, we can continue to make a difference in the society. Thank you for being here this evening, and let's enjoy this wonderful award evening. Thank you.
Now I request Dr. Merle Fernandez, Director of LV Prasad Eye Institute, to welcome on behalf of LV Prasad and also give a brief about what's happening for LV Prasad Eye Institute.
Good evening, ladies and gentlemen. It's a proud privilege to be up here on the stage before you again for the 25th Dr. Rustam Ranji public lecture. And I'd like to thank all the Rotarians who are here with us today. My first slide is actually a tribute to the 50,000 transplants that this organization has performed which is the highest compared to any other organization in the world. And what is commendable, thank you, the team that has brought this together, we're very proud of that team. And we'd also like to acknowledge the fact that the Rotary Club has also been instrumental in this journey, right in the early days when they supported the eye bank with with a specular microscope, which is used for counting the endothelial cells on the donor corneas, as well as the MK medium that is used for preserving this tissue. So their support was, instrumental in us reaching where we are today. So thank you for that. So this young gentleman is 17 years old with a condition known as Hallermann-Streiff syndrome, hailing from this village in Kyonjar, which is in Orissa. And it was noted that he was moving around initially, and gradually his mobility became limited. He was confined to the four walls of his house. And his father noticed there was white opacity in both of his eyes. So they took him to the secondary center that we have in Kyonjar, where the ophthalmologist took a look, noted that he had developed cataracts, and then sent him to our tertiary center in Bhubaneswar, where he underwent cataract surgery. Because it was a complex situation, this kind of a cataract could not be taken care of in the secondary center per se, required more advanced care in terms of anesthesia and a detailed evaluation of the Hallermann-Streiff syndrome. And ultimately, he was sent back to Kyonjar, very, very mobile. He's a very active child now. Why am I telling you this story? Because our network has penetrated into the 4 states. We're at 308 locations in AP, Telangana, Orissa, and Karnataka, where we have our pyramidal model, which is unique to the organization, with vision centers, secondary centers, tertiary centers, and the center of excellence. And what you have seen is just one example of patients, of people with complex problems who have been diagnosed at the rural centers and then referred to the next level of care where their problems have been solved. We have a down-up model and an up-down model as well, where we have faculty from the tertiary centers who visit these secondary centers and help patients. We do surgeries for complex cases there as well, wherever it's possible. So we have now 22 secondary centers, 4 tertiary centers. The baby amongst these is the center that we recently opened in Kadapa. The others are in Bhubaneswar, Vijayawada, and Visakhapatnam, and the Center of Excellence here in Hyderabad. Over the years, we've evolved into these 10 functional arms, with patient care being our primary focus, as well as eye banking, rehabilitation, education. We're very proud of our rehabilitation services because of the empowerment of patients with visual impairment. Those who have incurable blindness are the ones we send to this department. What is interesting, what is unique to LVP is the fact that our rehabilitation services are integrated with the patient care services. In most eye hospitals, this is not a function that is integrated. It's a separate thing. So we say, I'm sorry, we cannot help you anymore, and you please visit another center for rehabilitation services. However, this is a service that was integrated within the system right from the very beginning. And we have also started a center in Tolkata, which is aimed towards training more people in vocational skills so that they can become empowered to get jobs and to fend for themselves and get better integrated into society. We have a very, very strong educational arm, and we have taught all cadres of ophthalmic personnel, right from the biomedical technicians to the ophthalmologists, and we continue to do so as we proceed. We are very happy with the fact that we have reached the number 6 ranking globally as far as our research is concerned. We're the number 3 in Asia and the number 1 in the country. We have recently received information that several of our faculty are also on the top 10 list of Stanford globally most cited ophthalmologists. Something else that's unique to the organization is the Center for Technology Innovation. And it's very unusual to find a eye institute where you have engineers as part of the human resources. And we have devised several instruments which will help us in our day-to-day activities. Some of them are listed here. We use them for examining patients, and wherever it's been kind of, where certain instruments are more expensive, or we would like to take care to the bedside of a patient, or to the rural areas, we've tried to kind of develop these instruments indigenously. We use our own electronic medical record, as most of you are aware. And with that, we have developed other, APIs or fits that you would say that will help us make our work a lot easier. And to that effect, we have actually, developed during COVID a device which helps us take photographs of patients. And we have taken that a step further. We have all these instruments put together on an e-vehicle, which then goes to a patient's house, and we're able to deliver home care services to somebody who requires it and who's unable to come to the hospital. So this, in a nutshell, is what LVP is about. The public health initiatives, which I've mentioned in the earlier slide, is something that we are, very proud of. But there's a lot more to LVP, which I think 10 minutes I cannot do justice to. And so with that, I'll have to say that, this pyramidal model that we've developed helps us to take care to our patients, which is appropriate, available, affordable, and accessible to them all. With the values that we have incorporated in our DNA, right from the security guard who stands at the gate welcoming the patients, to the housekeeping lady who cleans the floors, to all the staff who come in touch with patients, and even those who don't. This poem is something that we align ourselves with. This is a poem by Robert Frost, where if you look at the last two sentences, two roads diverged in a wood, and I took the one less traveled by, and that has made all the difference. So the slides that I've shown you till now are where we have taken the road less traveled and where we have made a difference. So thank you very much. Have a wonderful evening, and I hope you enjoy the rest of it.
Thank you, Dr. Merle Fernandez, the director of LV Prasad Eye Institute. We heartfully, warmly welcome the awardee, Dr. G. Natchiar. Ma'am, we warmly welcome you on behalf of Rotary Club of Hyderabad. Why we say Natchiar now? Because we are going to say how this 25th year Rustam Ranji Award came in, because we are going to remember Dr. Rustam Ranji. Now, he was a member of the Rotary Club of Hyderabad, a member who disciplinedly makes sure that every Wednesday he attends the Rotary Club of Hyderabad meeting. So on that day, his services will be closed. If I go about to Dr. Rustam Ranji and the award, Dr. Rustam Ranji, a renowned eye surgeon, was the charter member of our club. Born in 1901 in Mumbai, educated at St. Xavier's College, then ophthalmology from Oxford University. He served the Second World War in Indian Medical Services as a commissioned officer for 3 years. Practiced ophthalmology for 43 years. Is an honorary ophthalmologist to the former Nizam and a consultant to the State and Central Railways, Indian Airlines, KEM Hospital, Mumbai. He was associated with several charitable institutions. He visited several countries, but even he was busy, he made sure that he served Rotary, and he served as the president of Rotary Club of Hyderabad in the year 1961-62. He was so attached to Rotary that he chose to close down his clinic on all Wednesdays evenings so that he could attend the Rotary meetings, and he instead worked on Sundays. So that was his commitment for both service, Rotary service and the community service. Sadly, he passed away. He left us on the 17th December 1973. But in accordance with his wishes, his wife left a will bequeathing a legacy that the Rotary Club of Hyderabad, on her death, their niece, Miss Roshni Patel, and her husband, Minu Patel, executed the will that our club was the beneficiary. During their illness, neither Dr. Ranji nor his wife breathed a word of this to anyone. Similarly, the Patels took the trouble of hunting down the Rotary Club, with who they said had no contact, to hand over the legacy. The couple of years later, a further sum of almost 8 lakhs out of the estate of Dr. Ranji was handed over to the Patels, and then the Patels handed over to the Rotary Club Hyderabad Trust. They attended the first awards presentation ceremony on the 16th September 2000 and have been present whenever possible at the award functions. Unfortunately, both Patels passed away since and sorely missed. In the same way, when we miss the Patel family, we also miss one of our Rotarians, in whose year this award started. Our own Rotarian who passed away a few months back, Annapurna Shastri, in whose year the award was started. The first award was started when she was the president. We miss her, so missing, because she was there. She made sure all the 24 years she was there to introduce about Dr. Rustam Ranji. And we remember her. So the legacy goes on through Rotary. And thanks to L.B. Prasad for helping us, L.B. Prasad Eye Institute, helping the Rotary Club to make sure that legacy is on. And perhaps these are few of our awardees from the year 1999. Dr. Assam Morton, Professor Sharat Chandra, Nirmala, Dr. Seshakiran. We have all the list of all the 24 previous awardees who've been there with us, receive it. Even in the COVID times, we made sure that we had presented the awards through online. And this year, for the year 2024, we have Dr. G. Natchiar going to receive the prestigious award. With no more delay, I request Dr. Sirisha Sendil to introduce our awardee.
So it's an honor and a privilege for me to introduce Dr. G. Natchiar, my teacher, my mentor, and possibly one of the persons whom we used to be really scared of. But I can tell you one thing, that this is from my heart. What I am today and what several of us who were trained during her tenure are today in their profession, as well as the values that they take forward, is because of her dedication. All she had to do was just look at you, and that look, whether it meant she approved or she disapproved. Okay, but thank you so much, madam. So I just have to tell you that she is one of the 3 people in Aravind Eye Hospital who's a Padmashri awardee. I think very, very rarely you see that. In a family, 3 people, and both husband and wife, both Nam as well as Dr. Natchiar are Padmashri awardees. And that's an honor, highest honor that is given for all the work and the dedication that they have done and carried forward and continuing to carry forward the Aravind Eye Institute. With regards to Dr. Natchiar, if I just have to say, she is a strong person and strong-willed person. And I just asked my mother-in-law what the name Natchiar actually meant. And both my father-in-law and my mother-in-law have worked together with them, and they've been friends for several years in Madurai Medical College. So she said, a woman of high stature. So that's the name, what Natchiar means. If you want to really represent or really call somebody as Natchiar, it means that it is the lady who's of the highest stature, which I think is something that she is and she will continue to be. That's her name. And she, she is the name, I would say. She's one of the founding members of Aravind Eye Care Hospital, along with Dr. Venkataswamy, who's her elder brother. And through the many years, so she's going to talk about her 50 years of journey. Through the many years, it's not just training the postgraduates, taking care of the privileged and the non-privileged, but mentoring people. And her heart goes down to the cadre of people who are in the lowest, or that means when she started with mentoring there's a set of, we call them as nurses or sisters. They are the people whom she trained, and she'll continue to inspire them. They are people who come from small villages in and around Madurai. I have to tell you this, if a lady or a nurse is trained in Aravind Eye Hospital and she's working there, she will be married into a very good family. So that's something that I have heard, and I continue to see that people just come and they transform. Everybody are in their white saris, and you see all of them behave the same way, speak the same way, and speak the same language. So I think the dedication and the discipline that is inculcated in that cadre, you can understand from where it starts, whether it is the spick and span area, the place that should be, or if you see even a small, same thing with Dr. Rao, even if you see a small, dirt there on the floor, she will pick it up herself, and all she has to do is go and throw it there and look at people. Ennamma ungalukku kannu theriyaliya? It just tells you that she won't say anything more. So she's never harsh, but I think those few words that she says, they will never miss that ever in their life. So this is in short about Dr. Natchiar. Coming to her professional achievements, they are immense. They are immense, and she was trained both in ocular pathology as well as neuro-ophthalmology. We were privileged to have our neuro-ophthalmology classes by her. And so she would teach us in such a way that if there are 12 of us in the class, she would pick from the right or the left, front or the back, and each person is supposed to answer or ask a question. And so we used to read and possibly pick up or mug something, one point where the others shouldn't tell, because you cannot repeat. So, and she used to be there sharp on time and take her classes, and we used to really look forward to that. Whether it is surgical training, whether it is seeing the post-operative patients, she will only see the post-operative patients in the non-paying hospital, not in the paying hospital, to see what is happening, how the trainees are actually taken care of. And it so happened, whether you'll remember or not, I remember that if today, whatever I am, and if I am able to do a certain type of surgery in a certain way, the credit goes to her. Because once one problem or a complication that she had pointed out, and I thought, never in my life I would want this to happen ever again. So that's the kind of impact that she had on all of us. And thank you so much, madam, for being here. And it's a really privilege and a great honor to receive, to listen to the Rustam Ranji oration this year. And we are looking forward to your lecture.
Now the time has come to witness the presentation of the award. I request Dr. Prashant Gar, the Executive Chairman of LVPI, and also Dr. Merle Fernandez, Director LVPI, joined by our member, Dr. G.N. Rao, to present the award to Dr. G. Natchiar. Thank you so much. Now it's time for us to hear from the award recipient, Dr. G. Natchiar. The presentation, please.
First of all, good evening, everyone who are gathered here, Rotarians, and also the employees and chairman of LVP. My talk is going to be very light, so sit and relax. There's not much of ophthalmology because I'm not in that position now. Now, this, what you see, my pictures, purposely the transformation of my profession. I also was young, like all of you. And you will also become old, like me, later. So this is just to remember the evolution. So I used to think when I was young, I'll never get old. I'll be like this. So there are some people who think that way. So I just wanted to show how transformation of the physical body occurs. As previously mentioned, I've heard about him a lot, but very nice things about Dr. Rustam Ranji is a reputed ophthalmologist from Hyderabad. He's a committed Rotarian. I heard he was a chartered member and a former president of the Rotary Club of Hyderabad. And he was also involved with multiple charitable institutions for the blind. So I'm really honored to give this talk in the memory, especially on the 25th year. Regarding the Rotary clubs, the president and the secretary and the members of the Rotary Club Hyderabad District 3150. We are very, very proud. As an ophthalmologist, we bow down to see how much you have done. You have connected ophthalmologists to the community. I think as far as I'm familiar, you have helped us in outreach activities of the entire country, wherever the Rotary clubs are there. The second, you have helped us in starting our vision centers, and the Rotary Eye Bank is well known throughout the globe. So as a bridge between us to the community, you have done a lot. So I'm really humbled and I'm very happy to be here, and all of you for that one. Now, the talk which I'm going to share is for the youngsters, the younger generation of ophthalmologists or the young people whom you all think you're going to be young. The change, of course, all of us know, the change occurs every second. In our days, change was occurring little slowly, but today, after the gadgets and all those things, it's a continuous process. The significant transformations or changes occurred in every lifestyle, food habits, education, medical field. But one interesting thing, I think Dr. Rao or everybody will agree, that ophthalmology in India underwent more radical transformation than any other specialty between 1970 to 2000 onwards. People born in my age group, that is 40s and 50, people born in that period will appreciate much more. The present generations, you're all sitting behind, you think ophthalmology, what today is the ophthalmology forever. So the whole transformation occurred because of the following reason. Now, coming to the evolution, like how this transformation occurred. In 70s, ophthalmology was not highly sought after. There was a little public awareness. Blindness rate was very, very high, especially in India, especially in northeast areas, due to preventable causes like vitamin A deficiency, simple bilateral mature cataract, and also refractory error. Ophthalmology was considered as a unglamorous specialty with few doctors choosing to specialize it. When I joined in 61, everybody was looking at me very pathetically. Poor girl didn't get any seat anyway, so she has come as. But my brother, Dr. Venkatsamy, said, if you don't become an ophthalmologist, where will I go? How do we prevent avoidable blindness? So he also asked me to join another 3 classmates of mine, and they gave us full pay, all the benefits, because we took ophthalmology, because nobody was there. And all of them were male except me in my batch. But today, the seats are filled up. And all of them, I don't know, in Hyderabad, LV Prasad, in Madurai, one boy will be sitting pathetically in one corner. The 20 girls will be surrounding them. Is it true here or not? Especially the fellows. All that transformation is much huge. So those days, vacant seats were there, especially in radiology, dermatology, psychiatric, and eye. Today, all 4 in the apex, top. It's very, very hard to. So what a transformation. And who was responsible for this transformation? The role of non-profit pioneering organizations mid-70s. I would like to congratulate Dr. Rao, Dr. Venkatswamy, and Dr. Badrinath. All the 3 started in the South a huge eye care center, which set high standards and revolutionized eye care in India, thereby creating great awareness. They not only went to the community, they had a training program, they had a holistic approach, research, basic eye care training program. Similarly, in the north part, Dr. Mere from Sitapur and Chitrakoot were the pioneering organizations. So they all came in early 70s. The government initiative also took care. The government of India, I think Dr. Mere and Dr. Venkatsamy went for the if I remember correct, it was in 1956. And they had a national policy of outreach activities throughout the country. And they also created a lot of awareness. But the best part, the responsible for the transformation, came IOL. Earlier, the patients used to wear a thick glasses, what you see on the First Lady. The quality of vision was not there. The comfort zone was not there. But still, they were very, very happy because they got back the vision after a full mature cataract. So then now the lens which you see on the blue one has replaced the glasses. So that encouraged most of the patients to take up early surgery. And the macroscope, people used to operate with the naked eye or with a loop. Now sophisticated microscopes came. And then we had a training center to make the macroscopic surgeons to microscope from tradition to the IOL surgery. The last factor for the great awareness was eyes are the windows for the body and the soul. The windows for the body, any problem in the eye, whether it is in the brain or in the immune system or in the endocrine glands, you can reveal it in the eye. Same thing, soul. Any reflection, imagine which organ can show reflection, anger, love, kindness, hatred. You cannot show it with your nose. You cannot show it with your mouth. But the eyes are sparkling. So the ophthalmology as a field, such a beautiful field, where you can get into the heart of a person, brain of a person, everywhere. So, and as a neuro-ophthalmologist, I used to enjoy eye, what you see is not the eye alone. The whole structures belonging to the eye are inside the brain. So any insult in the brain will also show some insult in the eye. So as a result, the endocrinologist, the neurologist, and the neurosurgeon were doing it. Similarly, the physicians for metabolic dysfunction like diabetes now, hypertension, the immunologist, obstetrics gynecology, eclampsia. There's no other any field which does not refer cases to ophthalmologists. So today we are the heroes and heroines in the entire field. So these are the four main causes for this great transformation in this 30 years, for 50 years. Now, I'm going to keep it very simple. What are the changes that happened in the ophthalmic practice? I don't know whether you're fellows or PGs. It may like grandma's stories, so you have to listen. Then how did the patient felt in this 50 years? And how did we as an ophthalmologist are behaving in these 50 years? And what did we gain in our life? And what did we lose? So these are the 5 points I'm going to share now. Yes. Now, changes in the ophthalmic practice, if you take the medical record. When I was working in 65 in government hospital, there used to be a paper, just a paper, without a seal. So we used to scribble something and they go to the pharmacy. I don't know whether they give a right now, neither I can read or patient can read or anybody can read. And we put a signature very big, as though the drug name will be small and our name will be much bigger. So that was the pride we were enjoying it. Then came a seal, hospital seal will be there. And that's a big, great license for everyone patient to carry. Then 70 to 2000 records came. In Aravind, we had multicolor records, glaucoma one color, uvea one color, retina one color. And then we were using all the colors. Then came electronic medical record. Now the picture on your left, ophthalmologist is seeing the patient's face. But to the right, the ophthalmologist is seeing the machine. And poor patient is looking where to look. And coming to the instruments, I practiced my ophthalmology only with these 5 instruments. And I could take care of all 80 to 90% of the diseases in a very simple way. A torchlight, direct ophthalmoscope, Chiart tonometer, trial set, basic surgical. That time the budget was 15,000 rupees. And I was taking my fellowship with Professor Walsh 60 years back. He used to do pupillary examination with a torchlight and diagnose spontaneous glioma. See how much clinical knowledge we had at that time. And he'll say, I'll show you three blind people walking and tell me the diagnosis from the walking style. So a blind man from birth will walk comfortably. You must have seen. A beggar or somebody, he won't search. He'll just walk. Acute blindness like central retinal artery occlusion or sudden loss of vision will have all the organs will slow down. The face, the walking, all those things. A person with a field defect will walk to one side. That was the time we were taught how to use our clinical knowledge. Next. Today, nothing is there. We have sophisticated slit lamps, custom-made operating microscope. I heard some microscope listen to the surgeon's voice only. I've not seen it. Even to raise or to fall. Only that voice, it's connected. And high-end surgical instruments, wonders cameras. What happened to our intuition? What happened to our experience? What happened to our knowledge? Now, coming to the investigations, these were only 5 investigations we used to do. Blood pressure, any surgery, urine analysis, fundus, measuring intraocular pressure, measuring fields. We had OCT machine first in retina. Now, every specialty clinic in our hospital has OCT machine. So that was a situation. So totally we have become machine dependent. We have forgotten a big brain is waiting there to listen. Similarly, opticals. We had a single optical, single monofocal, came bifocal, came trifocal, multifocal. I heard something else has come, I really don't know. And cost of a lens more than 2-3 lakhs per pair. And somebody said, when my wife is wearing a diamond necklace, can't I wear this? That was the feeling of a men I heard in the optical shop. Now, those days, the common IDSs were infections like purulent conjunctivitis, corneal ulcers. The minute they'll come with panophthalmitis, endophthalmitis, lacrimal sac. I just wanted to ask Dr. Rao, is there a specialty called dacryology in LVP? I want to see the doctor. I really bow down. I'm so happy to see you. Same time, I feel sorry for you. In Madras, you went there, I believe. And all our PGs, madam, in that small sock, enna madam irukku. He was talking from the morning till evening. And you have published more than 600 papers. Wait for 40 more years. What will you do? I really appreciate that. So today, in addition to all the diseases, now new diseases have come. We have not become super duper. We have much more to treat, much more chronic problems, much more blinding problems, diabetic retinopathy. Macula, as a student, I've seen only macular edema. I've never seen a macular, anything black, we call it macular degeneration. So all these details were not there, but today, every other case is a dry eye. So the gadgets take care and it'll become much more. The lubricant drops company has become so rich. They are opening up branches everywhere. And, the cost of the drop, artificial tear drops, ranging from 80 to 450 rupees. Now, ophthalmology was once upon a time, one eye doctor will treat all the diseases. He may refer retina. In my days, Dr. Pava was there in Sitapur. So anybody who can afford will be going there. All other RDs will say like a cancer, what to do, nothing could be done. That was a tragic thing because not many retinal surgeons were there in the country. So one shop, the whole thing is over. Today it's like a mall. You go to general clinic, go to glaucoma clinic, then there's a little retinal hole, you go there. Then there's some cells in the uvea, go there. And then some, counting the time and counting the money, counting the thing. So it's good. I'm not blaming it, but we should realize it. Is it really important? The time, the cost. Next. Now, cataract surgery, if you take, this is Dr. Venkateswamy doing with the loop. I don't know, it must be in 50s. Today, very sophisticated microscope, and the microscopes, the Zeiss or the Topcons, they come out with so much fashion. Mad, sir, this is done only for you. It'll respond only to your hand, and we'll be looking with the mouth open, like all those things. But it's something which we are not a fake, but it's like a brainwashing to all of us. That microscope will work for everyone because it's such a small thing which is adjusted for your height and weight. But we think this microscope is customized to you and the company has done to you. So we sort of pay so much to enjoy that honor. Next. Coming to the surgery, I don't know how many of you have seen the couching. I was a student, I saw the couching in some of the villages there. It's going to come again. So couching became ICCE, intracapsular, extracapsular, small incision, PACO. Next, please. Now, coming to the anesthesia, couching was done under local. Today, what we are doing? Local. But the transformation became, when we were there, retrobulbar. When I became a teacher, peribulbar. Then when I retired, it became infiltration. And now topical. So, again, we are going back to the original ones. Size of the incision, couching 1 millimeter. We started with 14, 12. It was almost like keratoplasty. When we were teaching our PGs, we used to give so much of importance to the sutures. It's almost like a keratoplasty. And 80, my God, such a thick, patients used to have all the reactions and that pulling, astigmatism, we were not bothered. We thought 6 is more than enough. Next. Then coming to the capsulotomy, the puncture was earlier, extracapsular, 1 incision, 3 o'clock, punctured with a graphene knife, then entered at 9 o'clock. Today also the same puncture, but is transformed into cane opener, linear, envelope, rhexis. The lens removal, again, it has gone through all these transformations. Now I heard it's only a protein and put a puncture and it lies the proteins, so no surgery. Or take away the epithelium, take out the cortex, leave the epithelium. Epithelium will grow back into a clear lens. Maybe another 20 years, let me know what happened. I may not be there to see that. Next one. Now, so lens now. Now the lens, I have used AC lens for almost 2 years without knowing the angle structure, without knowing the glaucoma part later. We used it. It is transformed to 3-piece, single piece, bifocal, multifocal, foldable, injectable. Suppose if they discover a drop to dissolve the cataract, we'll all be out of business, isn't it? The sutures, earlier no suture, now no suture, but the transformation has gone through 980 silk, nylon, all these tenno, all these things have come and gone. Next. Now, shift in care. In my days, people used to stay for at least 7 days in the hospital. So we used to go in the morning 1 round, evening 1 round. We go there and sit with them, talk to them. And by their discharge, we'll know all their family history and they will also know all our histories. That was such a, they used to offer coffee, we go there and sit. That relationship is no more now. You don't even see the sex of the patients. One day I asked the postgraduate, he was describing a case. So was he, how old was he? 1 minute, madam, let me check in EMR. The patient has not seen the face, not seen the age, but talking about that disease a little more deeper. So where are we? Next one. Now, quality, in my days, we used to do vitrectomy, everything, but we'll give 6/6. Oh, I've given 6/6. But today, patient does not want a quantity, but they want a quality. In spite of, because we operate very early, sometimes prophylactically, and we give them a vision. No, sir, I was able to read without glare. Now I'm not able to drive. That phase, you see it much more today. So the machines and technology are becoming dominant in healthcare. In some case, they are replacing the experience and clinical knowledge of doctors. Next. Now, that's about the practice. Now, what is the patient feel? This is the situation in 70s. To your left, that's a doctor. See how dignified, cross-legged, yeah, with a weapon in hand, ophthalmoscope. And the patient, very humble, does not have any basic knowledge, is asking, doctor, I'm not able to see well in both eyes. I've come here to see you. What best you could do? You're like my God. This was the complaint patient during my time. Next. Today, you don't have any control. So now you have become a technician. Oh, my patient wants that IOL. 85-year-old lady will come. What lens you need? She's going to live for another 5 years. She needs vision, undoubtedly. And you charge a very high-end lenses. Is it fair enough? And see the position of the doctor. Next. In 70s, patients trusted doctors fully, and doctors had personal relationship. Dr. Rao, my wedding was in 1965. There were 1,000 people came for the wedding. About 700 people were my patients. Today, do you give up any invitation to any patient? No, the trust gone. Similarly, now the patient trust as towards the instruments and equipments you see on your right side. Next. The quantity, as I mentioned, now it has turned to quality. Next. Now, earlier, my God, doctor saw me from the distance. He smiled, I smiled. He thinks he's cured. Today, patient wants the doctor to hug him, to keep him for at least 50 hours. I'm paying so much. Why not he do this? Radha, Appa is coming. So, demanding doctor's time and personal attention was very, very high. Next one. This, all of you, the younger generation, must see this slide. Any mishap those days, I have produced quite a lot of endophthalmitis, but they'll come back to see the other eye. Madam, you are like a god. You have done your best. It's my fate. Today, by the way, meet my uncle who is a lawyer. You're seeing it, isn't it? So that mishaps, all these things are occurring because you have lost trust and the patient's relationship. Now that's about the patients. Now we, ophthalmologists, can you sit straight and watch? Have we changed? Has the good relationship between the doctors and the patients faded? As a senior person, I strongly say it's yes. Next. Now, in 70s, I'm not criticizing anyone. I'm just seeing the journey. In 70s, doctors accepted slow, modest professional growth. How did they become doctors? Sowed clinical knowledge, watered with hard work and clinical skill, enjoyed the fruits, served people, looked upon as God. That was in 70. Next one. Today, doctors want quick growth, quick money. Sorry, Rotarians, not everyone, but I'm just saying it. I think in every field it's happening. And quick fame. You know, I have to publish, I have to perish or do the research, I have to get all the awards. And you don't think of the partner, professional partner, the patient in your life. And in order to, no, the previous slide. In order to have all these quick things, the doctors are taking loans. Now the banks are pushing us. Posh buildings, sophisticated equipments, earn and struggle to pay back loans. Both of them are not happy. Next one. Now, in the past, consultation fee were very minimal. Today, economic pressure have led to a significant increase in consultation fees. and the lifestyle of doctors has changed accordingly. Next. Now, there's absolutely the human touch has diminished. And we have forgotten to use our full knowledge and expertise to identify. We used to have an intuition. It looks like that. I feel it's like that. All these intuitions came out of experience. Now you straight away, send them OCT, MRI, CT. So all these things, anybody can do it. And so what happened to your experience, what happened to your learning, it's a question mark. Previously, doctors used to say the financial condition of the patient and adapt. An 80-year-old, it's okay, or normal lens can do. If he's a pilot or if he's a young man, you need to have a special. Now, age and the financial situation, job are not considered when you examine the patient. 80-year-old lady and a 40-year-old person get the same lens. You have to think of the financial conditions. So somehow I feel there's a shift to business-oriented approach. Next one. So we have seen all the positive and the negative. So what did we gain? We have gained lot, absolutely true. Technological advancements in equipments, surgeries, investigations, and drugs have simplified medical work. To diagnose a chromophobe adenoma, I used to spend 1 week taking fields one day, taking X-ray one day. Today, in 5 minutes, I can get a scan. Madam, it's a chromophobe adenoma or craniopharyngioma, anything like that. There's absolutely no doubt it, no question about it. These developments allow us for a higher volume of patients, cases, earlier diagnosis, quicker treatment, initiation. We have now teleophthalmology, patient complaints of watering. I think sir will think of dacryocystitis, somebody will think of postoperative irritation, somebody will think of foreign body. So I don't know how it's going to help and evolve. Simulators are there. Webinars, every day, hundreds of webinars are there. Publications and research work in the field have increased. These are all the advancements, no doubt about it. Next one. But what did we have lost? We have lost almost everything as a doctor. Decreased personal interaction. How many people, madam, I went to the doctor today. She was wearing a green dress. She was suiting her so well, the patient. And now, none of them are either the patient, he doesn't know about a boy or a girl or a male or a female or an old person. And because EMR is there, and EMR is your technician, EMR is your personal secretary, and EMR gives you all the history instead of patient. And you don't rely on your clinical knowledge. Then why postgraduate courses? Why fellowships? Why so many cases we are seeing to get intuitions? Next. Now, there is one quote in ophthalmology. The impact of an ophthalmologist's work extends far beyond the clinic walls, reaching into the hearts and lives of every patient they touch. Just hold one old lady or old man. That's it. Their blood pressure will come to normal. Their blood sugar will come to normal. They won't go anywhere. They'll trust you. But the way you talk, I'm not talking everyone. The way we react, we think we are next to God. But without a patient, we don't thrive. But patient can thrive. Patient can go and choose a doctor. Can you go with a bag and select a patient? It's not easy. So, next. So one more thing I just wanted to say. Just think about the pandemic. Why it happened? We are so good in everything. The life has become small. The world has become small. What happened in 20 and 21? None of us could talk. None of us could go out. And none of us knew what to do. So this advanced technology, you need that. But world struggled with a tiny, tiny virus. And the whole life stumped for almost 2 years. So this is just a reminder in contributing. There is something beyond all of us. Next. So in conclusion, technology versus human touch. Technological advancements have improved medical practice, absolutely no doubt. Everywhere, we need them. The human element in healthcare has diminished. This should be avoided. A balance between cutting-edge advancements and compassionate care is necessary for providing excellent treatment. One clue: suppose a girl gets married, goes to a mother-in-law's house. The mother-in-law is not very friendly, but all others are friendly. The daughter-in-law will not leave the home. But if everyone is not friendly, where will they go? Like that, if you train your employees, especially the organizations like this, the purpose, the vision, and the mission of the organization, explanation regarding compassion, love, clinical communications, if you explain to the people, because from chairman to the cleaner, they work for the same purpose. Dr. Prashant, Dr. Rao, and the cleaner, they have the same purpose. If they don't work, we won't be able to achieve. But we think we are the greatest person in the world. So why don't you share the vision and mission to everyone as an orientation? And she should have a pride. If I don't clean, they can't do a good quality surgery. So suppose if you are not doing anything routine, if they start showing some compassion, "Emma, ekkada pothunnavu? Ekkada undi toilet, ekkada undi idi." So that's enough for the patient. So that, I think, Dr. Prashant Garu, you have to train, or even in our own hospital, we have to share our vision and mission to every employee so that they are not employees. They are our professional partners. Just like in your family, you have a husband and a wife as a family partner. In the institution, every employee is our professional. The minute you think they are our partners professionally, then you respect them and they respect you. And they also feel it is their responsibility to take care of the patient. So ultimately, the profession should be about serving humanity with empathy, trust, and respect last. Finally, it's a great profession. I told you this is the only field where you can have the entire body and also entire mind, entire heart, and entire soul. You can show all the reflections, and we have to serve. We are serving and also earning. There's one more area where people serve and earn is the temple priest or the church. They serve the God, they earn. We serve the human being, we earn. So it's our responsibility to make our patients happy. And I strongly feel, and I'm very happy I'm old. And if you don't wake up now, show the kindness to the patients, because they are your bosses. And all the crowd and all, it's coming to the technology, not alone. So treat them well. Next one, I think that's the end of it. And I strongly feel it's a beautiful field and all the youngsters should enjoy the profession. You are not giving sight to a person, but you're giving life to the family. So you should be, I really appreciate the hearing of everyone. And the people who are recently now, change, not you, everywhere. Books, publications, research are not your bosses. The bosses is your humble patients. So take care of them. Thank you very much, Rotarians. We are very, very proud and thankful for your kind help and all those things. Srisha, thank you very much for your nice introduction. I know, but because of the younger generations, they may say, "Madam, this is coming in that journal, 133 page, second paragraph. But you don't remember the patient's name. You don't remember that. Is it true or not?" True. So the life has to be for everyone, not only for the doctors. Patients also have to believe. Any questions? I don't think they'll. It's very simple. And considering the Rotarians, I thought, and also I'm not good in talking the subject. I'm totally outdated, as I was telling. I don't think now I can sit and see, examine a patient. I don't know the names of the drops. And the teardrops becomes one of the prescription for any disease, the dry eyes. So that's a situation in Aravind also. I'm not blaming anyone. But I think you just think back, start respecting the patient. Not a big way, but give a smile, give a touch. That will create a lot of miracles. Thank you.
I asked my president, can you add some kind of a sense of humor during my course of anchoring? And she don't know, it's a serious business. But I should have spent time with Dr. Natchiar before than spending with my president. Then I would have realized the sense of humor is more needed than the actual subject. Thanks, ma'am. You made a big difference in all the crowd people. Kind of smiles this, I think. At least last 7-8 years I've been here for a lecture after I joined Rotary. But this was one sense of humor, crowding with sarcasm added to it. But Dr. Shalini will give an overall view of word of thanks. Before that, we'll close with the Rotary formalities. I request Moinuddin to give the thought for the day.
Hi, good evening. The thought for the day. Yeah, okay. This is by Henry David Thoreau. It's not what you look at that matters, it's what you see. And the mind believes what we see. Thank you.
I request Dr. Emil Wahid to read out the 4-way test.
Good evening, everybody. As he said, Dr. M.A. Wahid, I'm not a medical doctor. I'm an educational doctor. So coming to 4-way test, I would like to give you a little background about the 4-way test. 4-way test is nothing but the constitution of Rotary. As I think many of you know, that Rotary was started in 1904. Before 1904, there was no word Rotary in the dictionary even. But the father of the Rotary, Paul Harris, when he started Rotary, there were 4 friends. They used to rotate one by one to their different houses, and with that rotation, the word Rotary has been born in the dictionary. So the father of Rotary is the Paul Harris. He is also, his autobiography is very popular. I would like to request the Rotarian and even the non-Rotarians also to read his autobiography, Road to Rotary. I read it long ago, but I request because as a part of the literature to social service. The philosophy of Rotary is service to above self. That is the main philosophy, service to above. But now, this 4-way test, as I said, is the constitution of Rotary. There is a background for that also. There was a Rotarian, Taylor, Mr. Taylor. He had an industry, automobile and aluminum factory, transportation industry. There were about 250 employees in his factory. Every year he was getting loss. He became bankrupt. Then he did research. What is the reason? He read a lot about morality, ethics, truth, reliability, friendship, all other things. Then he framed these 4-way tests. And later on, Rotary has adopted the constitution also. So I gave the whole background of 4-way test, but what are the vocabulary of the 4-way test? There were only 24 words. Is it the truth? As I told you. Is it fair to all concerned? As I told you. Will it be goodwill and better friendship? As I told you. Will it be beneficial to all concerned? That's all. That is the philosophy of Rotary. Thank you all.
I request Dr. Shalini Singh, consultant ophthalmologist, to propose the vote of thanks.
A very good evening, everyone. As we come to the end of this wonderful gathering, it is my privilege to stand before you to express our heartfelt gratitude. First and foremost, I would like to extend our sincere thanks to Dr. Rustam D Ranji family and to our esteemed guest for today, Dr. Natchiar ma'am. Sorry. Your insights about the evolution of ophthalmology today have been truly enriching to us, ma'am. We are grateful for the time and effort you put into sharing your experience with us. A special thanks goes to Rotarian President Rizwan Haider, Secretary Rotarian Mr. Sudhir Jaligama, past President Rotarian Moinuddin Ahmed, Rotarian Tansen Pandi, and Rotarian Dr. M.A. Wahid, and other members of the Rotary Club of Hyderabad, District 3150. And last but not the least, our organizing committee, whose hard work and dedication made this event possible. From planning to execution, your meticulous efforts did not go unnoticed, and we appreciate everything you have done to ensure a seamless experience for all of us. And lastly, I would like to thank each one of you who are present here today. Your participation and enthusiasm have created a vibrant atmosphere and made this event truly memorable. Thank you once again. We look forward to seeing you again next year. Thank you, everyone.
Thank you, Dr. Shalini Singh. Before we adjourn the meeting, request you all to raise for the national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
I request President Rizwan to adjourn the meeting.
Meeting is adjourned. Thank you.
Thank you all.